Joel Embiid has been clearly laboring through the playoffs, but one of the biggest mysteries is that ever since we saw him re-aggravate his knee, something really weird and bizarre has been going on where it doesn't seem like we've seen Embiid blink his left eye. Welcome back, everybody. I'm Dr. Brian Sutterer. My goal in this channel is to help teach you about the medical side of the sports world. And this one is really interesting because we've all seen back when Embiid sort of re-aggravated his knee in game one, we saw as he was laying on the court here, something funny with his eyes, right? He was only closing his right eye. His left eye did not close at all. And since then, I honestly don't think I've watched enough of the footage. I don't think I've seen him blink or close his left eye. This was when Embiid was on the free throw line towards the end of game two, and look real close. His right eye, quick blink, nothing with the left eye. Rewinding that and going even slower, there we can see all of a sudden, boom, that right eye blinks, closes shut, but absolutely nothing with the left eye. And again, in this clip, we see that right eye closing. We see it acting almost like he's trying to get something out of it, but we don't see any closing or blinking of his left eye. So what in the world is going on here with Embiid's eye? The best we can say, something seems to have happened back in the first quarter of game one. We don't see anything with his eye back at the end of the season until about this play where the Knicks are trying to go up here and get a rebound. And it looks like there's some degree of contact between one of the players on the 76ers and Embiid's face. We can see he grabs at that eye right there. And ever since then, we've seen him affected by something funny with his eye. So there he grabs at his face. As he's coming back down the court, he clearly seems to be bothered by something. A few minutes after that, we see here slowly, it does look like his right eye starts to close, a little bit of a blink, but nothing again with his left eye closing. And then again in that first quarter, Hartenstein goes up here to try to get the rebound. Looks like there's some contact with Embiid. And once again, we see him grabbing at that left eye, kind of holding his eye as he walks off the court. I thought this was interesting. We saw Embiid on the bench at the end there between the first and second quarter, and he's kind of motioning at that left side of his face, almost like he's maybe trying to describe something happening or like getting hit or some pressure in that left side of the face. So this seems to be the time when something happened. And then just the last piece of all this, of course, last night after game two, Embiid didn't even want to look at the camera. He refused to look up, seems to be trying to cover or hide something with this eye. So it's just really bizarre. I think a great place to start with trying to understand what's going on is by first understanding just the anatomy and what causes our eyes to blink, what that reflex is. So we have a blink reflex. Our eyelids are there to help lubricate our eyes, but also to cover and protect our eyes. We have something called a blink reflex. So if you go up to somebody and you just kind of flick your fingers at their face or water splashes by, any sort of sensation, even if it's just some light air pressure on the outside of the cornea, which is the outer layer most covering the eye, that has sensory nerve innervation to a cranial nerve called the trigeminal nerve. There's a nerve pathway that senses that something has touched, irritated the front of the cornea, sends a signal back through the brain and down into the brainstem. When we get to the brainstem, all the way in the back of the brain, this is where the centers of our cranial nerves are located. So the nucleus, we call it, the area where the cranial nerves are going to originate and then go out to our head to control the motor and function of our face. So some sort of irritation onto the cornea, trigeminal nerve, we call it the afferent signal, sends a signal back to the brainstem, and then that activates the nucleus of the facial nerve, which is cranial nerve 7, which sends a signal back up to the face, specifically to a muscle called the orbicularis oculi, activates that muscle, closes the eyelid. So that's a muscle that goes all the way circumferentially around the eye to close the eyelid. Now, the nice thing about our blink reflex is that it activates both sides at the same time. So if one eye gets poked, there's a signal goes back to the brainstem. That brainstem is going to send a signal to the same side. We call it the ipsilateral cranial nerve 7 for the facial nerve, but also it's going to cross over to get the opposite side cranial nerve to go out to the opposite eye. So what that means is that this corneal blink reflex, if one eye senses that something is coming, the signal gets sent back, crosses over, causes both eyes to blink. Obviously, if there's some sort of defect, injury, etc., anywhere along that pathway going back out to the eye, the signal will get through to the brainstem, but it's going to be interrupted and not cause the eye to blink. So then we think, to me, this all looks more like something is going on with Embiid's left eye, causing it not to blink. One of my thoughts was, well, did he get poked in the right eye and he has some sort of like a corneal abrasion and he's just kind of blinking because he's uncomfortable. He's trying to kind of flush out maybe whatever's irritated in that right eye. But my suspicion is actually more that his right eye is working just fine, but there could be something going on not getting signal through to that left eye to trigger that left eye blink reflex. Now, it's important to know that you can just voluntarily close one eye. It's not that hard. You can sit there, you can close one eye, but it's really hard to just voluntarily blink one eye really quick. Now, what we're seeing here with Embiid in this clip, it's a little bit slower with how he's closing that right eye, but the one that we'll show in a second, it is a true quick blink that nothing happens on that left side. So it raises some concern in my mind of, is there something with that whole pathway where he's not getting the nerve signal back through to the opposite eye? That's specifically this one. We can see it's a very quick, if you play it in real time, you almost miss it, where that right eyelid closes and nothing happens with that left eye. So a couple of different random thoughts here. Number one, there's a lot of weird stuff in medicine where you have anatomic variations, things that people are just unique in terms of how their nervous systems are wired. Maybe that's the case here with Embiid, but the fact that he's trying to cover it and protect it makes me worried that there could be some true injury there affecting that left eye. These are peripheral nerves. So that cranial nerve 7 that goes out and innervates that orbicularis muscle, which closes the eyelid. If there's been some sort of trauma, some sort of almost like hitting your funny bone nerve, like a brachial plexus stunner type of injury with stingers in football, maybe something like that irritated that nerve from that trauma, causing some temporary paralysis or temporary injury to that branch that's causing that orbicularis oculi muscle to fire and to blink. So the signal's maybe getting back through to the brainstem, but it's not coming back out the other side to the left eye, and you're not getting that closure in the muscle. There's something different called ptosis. Ptosis is whenever you have weakness or a nerve injury causing weakness in a different muscle called the levator palpebrae. When that's weak, it causes your eyelid to droop, but this is specifically a different muscle causing the blink reflex. I know Embiid has had some history with orbital fractures, and yes, with orbital fractures, you can have damage to nerves, but looking back, I've seen video of him blinking just fine before this series. So I think number one, when we talk about all this, I think the team should come out and say something, because clearly there's something going on with Embiid. He's bothered by that eye. He doesn't want to show it. He's wearing sunglasses. People are talking about his funny blinking stuff. To me, that's something that has happened and needs to be communicated with at least eye injury or what has been going on. I think what possibly could have happened is some trauma to that eye, some trauma to the face, maybe temporarily injured, sort of paralyzed temporarily, either that muscle that goes around the eye or one of the nerves feeding into that muscle, which is causing that reflex to not get triggered through and to not blink that left eye. It's important if you do have paralysis of that muscle or you're not getting that signal sent back through, you need to lubricate your eye. And part of that is closing it to help some tears circulate through there. So this is something where you might even like tape the eyelid shut to help keep it closed and protected at night so your eye doesn't dry out if your eyelid is not allowing it to be closed. So a lot of really unusual things here. Yes, I've noticed. Hopefully that just discussion of the pathway. Remember, there's a sensory signal on the front of the eye. It senses that something is nearby. It senses something has touched it, sends a signal back to the brainstem, trigeminal nerve nucleus, sends a signal to the same side and the opposite side, cranial nerve 7 nucleus of the facial nerve. Signal comes back out to the eyelid muscle, fires the eyelid muscle to close and blink. My guess is something's going on with that left-sided reflex for Embiid, which is why we're not seeing him blink that left eye. And I think the team would be advised to say something, at least tell us what's maybe going on to make sure Embiid's doing okay, because he is clearly laboring with his knee. And now if there's something else going on where he's got some type of an eye injury, I think the team needs to communicate what could potentially be happening and make sure there's nothing more serious going on. So that's it for the video, everybody. I'm sorry I don't have a clear, specific, like it's exactly this answer, because frankly, I don't know 100%. I think it's helpful though to think through this pathway, how the anatomy works, and based on what we're seeing, postulate about what in that whole anatomy cycle could be interrupted. Hopefully we see Embiid start blinking again in game 3. It's a crazy thing to think about, or we at least hear that the eye is okay, the team is aware, evaluated it, and has no long-term concerns. Let me know as always any questions or comments down below, and until next time, we'll see you later.